Yeah. This chair has a hole in it.
You look relaxed. You look relaxed.
I'm relaxed.
Okay. Get back in the camera when you talk. Okay. Hi, everyone. Good evening. Thank you for joining us for our second edition of Climax After Dark. I am Dr. Ojo-Carons here with Dr. Ojo-Carons, and we're today talking about intimacy and men's sexual wellness, men's libido and intimacy. We had a little bit of a schedule change today, and so my husband was ready and able to step right in for us to have this important conversation about intimacy and men's libido. Thank you for being here with us today.
Thank you for having me. Thank you. This is a very important platform, and I'm happy to be a part of it.
So I hope we're able to have a nice, relaxed conversation and enjoy our time here today or tonight. So get your drinks if you don't already have one. It's the end of our day. We've both been busy in the office and also in the operating room. For those of you who do not know, my husband is a urologist. And so who better to talk about men's libido and also intimacy? And, libido for men and women, we oftentimes talk about reduced libido issues for women and have a lot of concern about that. But men also suffer from reduced libido too, wouldn't you say?
Yeah, I think it takes two to tango. So libido is just not this phantom sensation of, oh, that's I don't want to have sex. It's a feeling, it's a mood, it's the interest, it's the engaged, and it applies to both men and women equally. And I think we'll be able to talk about some of the factors and other things to think about as far as libido goes and intimacy later on tonight.
So how would you say it affects men's sexual health? Like, what's the one thing that you talk about most when it comes to libido with your patients?
Also, I mean, most patients come in, and the first thing you talk about is actually erection problems, erectile dysfunction. And it's until, you delve down and ask intimate questions as far as what is your level of interest, how engaged today in the sexual health, how engaged are your partners in their sexual health, before you begin to unpeel some of these layers of intimacy and libido. So libido, the definition is just the drive, or the lack of libido is a lack of drive for sexual intercourse and intimacy. And a lot of things affect it. It's not just erectile dysfunction, which is a subsequent um, consequence of libido, and it kind of fits into this continuous loop. So stressors events affect the libido. Anxiety, depression, performance anxiety. You've heard of performance anxiety. Men just worried over the fact of just trying to have intimacy with their partners. And because they maybe failed once or twice or three times in the past, they're worried about it, and it fits into this lack of self-esteem and interest. Foods, obesity, what we put into our system, alcohol, all those kind of play in. Um, Definitely obesity, because now you're lowering one of the driving forces of your libido, which is testosterone, and you're converting all that into estrogen. So a lot of factors that do affect the libido, and there's a few things that you can do that would definitely improve your sexual health and intimacy.
So, for women, intimacy and libido. First of all, do you agree there's multiple types of intimacy?
Elaborate. I agree, but you have to elaborate.
Okay. So there is sexual intimacy,
Okay.
right? I think when people think of intimacy, that's the first thing they think of, sexual intimacy. There is intimacy that is non-sexual, that can be intellectual intimacy. There can be intimacy in interest, types of interest one may have? Okay, so but do you agree there's different types of intimacy?
I agree. We read different books. Most men, intimacy is kind of very linear, which is kind of sad. But women, yes, you can have multiple directions and trajectory of intimacy. But for most men, it's the sexual drive. That's what's most men complain about when you kind of unpeel the layer. But
Okay.
yes, um, being connected to your partner makes the experience a little easier. Being able to discuss these issues with your partners makes this unspoken topic tolerable to people. So, for most men, you ask them what's wrong, they're gonna say, "I cannot get it off." That's the biggest issue, and it could be a real life, earth shattering issue if it's not addressed. It can ruin relationships. It can ruin self esteem, and um, but there is hope. There are things that we can do that things that we're going to talk about that can definitely help. But most importantly is this intimacy, this communication, and this connection that you have to keep open with your partner. That
Okay,
helps.
so then so intimacy is an important part of libido for men.
Correct.
Is intimacy an important part of the ability to have an erection? Meaning you have all other aspects of your health intact. You don't have diabetes,
Absolutely.
you don't have, but you still need a level of intimacy and connection.
Absolutely, because if you talk to some men, they can actually have a solid erection just masturbating, but when it comes to having sexual intercourse, they can't perform, and that's real. That's and it's I often ask, and we kind of joke about it. I ask partners, "Do you actually like your partner?" That's a very simple question, and many men will laugh at that question, but it's true. Like if you have issues and stressors and communication issues with your partner, then definitely is going to affect your libido and your intimacy. Um, and So those are conversations that need to be had and conversations that need to be addressed. Definitely we have men. You'll look at them and you say, "Oh my God, this guy has six pack. It looks great. It should be in phenomenal shape," and they can't perform. They feel kind of low self esteem performing in bed or pleasing a partner. So that also needs to be addressed.
So, all right. So intimacy and erection go hand in hand, right?
They do, absolutely.
Okay. Erection and orgasm, do they always go hand in hand?
It should. That's what most men, most even partners, even women expect their men to have because that's another level of intimacy. That's sometimes there's some men that can have erection for a very long period of time without ejaculating, anorgasmia, which can be organic, and then we have some men that actually prematurely ejaculate and they don't reach this sexual satisfaction they want, and that also feeds back into this low self-esteem, this loop of I can't satisfy my partner. So what do I do? So, but absolutely, intimacy plays a big role.
Okay, so that thought that if a man is stimulated, he can have an erection, he can have an orgasm. That's a myth.
Absolutely, it's a
Okay.
myth. It's a myth. Erection doesn't always mean sexual pleasure, but for most people, they want to please their partner. They want to feel fulfilled. They want to feel like they are the macho and performing in bed, and that fits into their increased libido, self-esteem, and all that.
All right. So then, if there is a level of self-esteem decrease, right, anxiety, stress, that plays a role in your ability, in a man's ability to perform, what can be done?
So I think you've kind of already talked about some of this. It's just having a line of communication with your partner, having a clear understanding of it's not always going to be great. You always want to have hope for great sex, but it's not always going to be great and have that communication as to what's going on. If there's a lot of stresses in the family, in the communication, in their relationship, of course, the sex is not going to be great. That's just kind of what happens. Um, Life stressors, money factors, financial issues, communication issues affects that. And then you start worrying about other health issues. So there's a lot of things that people do that also affects the erection, such as alcohol or kind of certain foods, just certain lifestyle habits that we know and that when you do it, it also it dulls your senses and inhibits you in having a good erection and sexual experience.
So we deal a lot with patients, clients. Are a main part of our practices. The main mission of Climax is to address sexual health.
Great
So-
sex.
So we talk about sex a lot. We talk about sex a
Great
lot at
sex.
work, but we don't talk a lot about sex a lot at home. Maybe we're sexed out.
Yeah, we
on
don't.
the conversation.
Yeah, we share a lot of wine and we talk about other things, but yeah, we don't talk about a lot of sex at home. So this is a very rare opportunity, and we're making the most of it.
Yeah. So I think, but you're right. So it's open conversation, open communication. Um, so firsthand, right? Being a physician who deals with sexual health, men and women,
Right.
being a man yourself, being a husband, what are some thoughts for yourself that you would think points, if you had to give like strategic points of things that need to be discussed in a relationship to make sex better, to make libido, to increase libido, to help intimacy?
So we're talking about conversation. So
From the man's angle, because from the women's angle, I have
it's
I can
complicated.
give you
Women's angle is
PowerPoint.
complicated.
I have your PowerPoint already.
It's complicated. Women's, yes. I happen to be lucky enough to wear several hats. I do treat men and women, just like Dr. Mary does also. So from the men's standpoint, is foreplay is actually it's not a myth. Foreplay helps. Just getting them relaxed from whatever anxiety and stressors is going on in their head.
Who's they?
The man.
Oh,
So the partner helping them understand it's okay, it's a safe space.
Mm-hmm.
That makes a big difference. I'm just trying to figure out what other strategy you can use. So that just having you could create time to have a sexual encounter. Also, a light mood. Create time for that, just like you create time for everything else you do in life. I think that makes that helps. That anticipation helps, and that's what the man appreciates. They feel like, okay, I'm able to perform regardless of even if it's a good sexual experience or not. Once you take that anxiety off their shoulders, then it's actually a better experience.
Okay, well, I think that's good advice. So, what are some, I guess,
so from a women's standpoint, I mean, what would you say helps women improve their libido?
I think you're right. You have to have a level of connection. I mean, we continue to use that word connection, openness. It's not easy to do, definitely, especially when you have angst of the day. But because if you think about what the act of sex is, you're in a vulnerable position. So if you have a partner and you're having sex with your partner, and to increase your libido, you have to be connected to them as a woman. Talk about the cycle for orgasm and arousal is very important. Desire is really important. And so when you have a deep connection with someone, you will start to desire them. I think when you're in a relationship, there's a lot of like baggage that occurs. And so working through that baggage as a couple, but also as an individual helps. So that's one. I think we've said that a lot.
Right.
But I think two, it's also for women as a 40. How old am I this year? 40.
I'm not going to come into
42.
that.
I'm 42 now. 43.
We've lost some age. We've lost some age over
some
the years.
I've been the same year twice, many times. But as a 43-year-old woman,
you're not even 43. Come on.
Well, okay, 42. Okay. I'm 42, and I look
in the
good.
40s.
I look good for 42.
It looks great.
Definitely.
Okay.
But as a 42-year-old woman, definitely, we get in our heads a lot. Our bodies have changed, especially if we've had children. Even if you haven't had a child, our bodies have changed. Our desires have changed, and so and our stresses have changed, and so definitely that impacts what we feel and also how we perform. So getting into a headspace in which you kind of like yourself. For me, get into a headspace where I find myself sexy and do things to make myself feel sexy is important.
Right.
So I think those two things, those are two things are both like mental.
Yeah.
Right.
I think and I agree with you, most of the sexual issues that we have beyond the organic and metabolic issues is mostly all, majority is just mental anxiety and stressors that can, if alleviated, would make it a better experience.
Yeah.
I just don't want to blame it all on,
on the mental.
On the mental,
Yeah.
because there are other physical things.
But it's a big
It's a
component
big thing.
because the orgasm takes place in your brain.
Right. Absolutely. Absolutely. You have to feel it to.
So it does, yeah.
For it to happen. So.
Okay, so then let's talk about physical.
So
erectile dysfunction, and you can't, because erectile dysfunction, you're saying is the main complaint that you hear, right?
Well, that's what most men complain about.
Okay.
What is erectile dysfunction? That's another big general term. Basically, not able to achieve enough a rigid erection for penetration or sexual intercourse. And we know, we have stories with a wide range of people in their 70s and 80s still having great sex, and we have people in their 20s, they're already having issues with erection.
Mm-hmm.
And so there is a factor of age in this, but there are other things that you do to keep yourself in shape and interested in partners that help. So ED is a big term. It's sensationalized. It's pharmaceutical, and marketers have spent a lot of money on it, especially on the men's side.
But the funny thing is, as much money has been spent on ED, it's like 4% is spent on women's sexual pleasure and dysfunction, which is a big problem.
Go men! See, there you go, men. Get them going.
Well, that's true. Men, but us women also.
Yeah,
women need to play. I go on about that. But
women need to play. So ED. So no, that's good. Because it affects. You see the women part of things, and they tell you about this, and so it affects both people. But again, mentally, it's the man that feels kind of. I don't feel like I could perform. I don't feel like a man, and so that's a big problem. So why do men have ED? A lot of reasons. A lot of reasons. One is we already talked about some of them. It's just mental part of this, which is anxiety stressors. Some is just obesity, foods to eat, certain medications that you use, some blood pressure medication, some diabetic medications. All this combination of medications would definitely cause ED, which is basically lowering sensation down to the penis and lowering blood pressure flow down to the penis.
What about anabolic steroid use?
So
not testosterone, but just like actual anabolics.
What do you mean? So so what happens with the idea of men's sexual health, ED, or sexual health in general, it's all hormone driven for the most part. So your brain stimulates certain glands in your body. We'll keep it very simple. Your brain gets stimulated. It sends signal down to some organs in your body, which are the adrenal and the testes, to make certain sex hormones. Mm-hmm. And so, from a physician side, trying to evaluate patients with ED, you want to make sure those axes are fine. So going from the brain, you want to make sure the brain is secreting enough, signal down to the testicles and the adrenal to make the anabolic and sex binding hormones and testosterone. And then you also want to make sure the testis is not filled, that's secreting enough testosterone. So those are the hormone panels that we check for us to begin to diagnose what level of failure it is, if it is metabolic. Mm-hmm. So when you talk about giving someone anabolic steroids, so what happens is your body says, all right, I'm seeing enough steroids in my system. I don't need to make anything. So it shuts down your own natural production. Mm-hmm. It shuts down your brain from saying, all right, I don't need to send signal down. And that in the long run could be a problem. In the short run, you could be the beast and, have a great, erection and all that. But in the long run, it's not sustainable because your body just decides, well, I see enough anyway, so I'm going to shut down my own production.
And so that, as opposed to, so you're taking anabolic steroids like to boost muscles.
Correct.
Versus you're using testosterone supplementation because you have low testosterone.
Correct.
That's what I mean, like distinguishing between the two.
Correct. But again, what happens is it's still the same organs. The organ, the adrenal, cannot separate what is what. So it sends a signal to the adrenal and says, all right, I'm getting steroids, even though what you intend is for boosting muscles. And the system says, well, I have enough steroid in the system. Yeah. Let me just shut down production. So your T eventually will go down. Yeah. If it's just anabolic steroids. Yeah. But if you do supplement with testosterone, there is still enough in the system. Yeah. Again, it's continuous supplementation Otherwise, again, it's a cyclical hormone, and eventually it's going to go down if you don't keep supplementing, or your body doesn't make enough by
Yeah.
itself.
But then will that, if you have ED, erectile dysfunction, will you getting that extra testosterone help fix that?
So yes and no. So this is one of the things I tell patients. ED doesn't always mean low T. We have people with and low T is a very subjective wide range. If you look at the blood test, it's normal value is a healthy male, 30s or something, but the range is 250 to 1,000. So somebody with 251, insurance company is going to say you don't have low T, but your brain and your body could feel like you have low T.
Yeah.
So it's a very subjective range. You have people in the low 200s, 300s that have erection, and we have people in the high 700s, 800s that can have cheap erection.
Yeah.
So it's not so low T doesn't always mean ED, but it can certainly help augment the experience, augment what your body's craving for.
Yeah. So then, what's a like cut and dry easy treatment for ED? It's saying that you've incorporated the emotional relationship. You've taken part. I always say to patients, there's 3 things that have to be addressed when you are talking about orgasm.
Okay.
And so that is hormones. That is your anatomy. And then the third is overall well-being. And
Correct.
so we talked about the overall well-being. You have addressed the hormone, right?
Yeah.
So I guess the third is anatomy. What would you do for that?
So, well, anatomy, that's another wide range. I mean, so what is anatomically wrong for you to have ED? And it's not just one thing. Some people have small phallus, small penis, and some people have curvature. Not all curvatures cause ED, meaning lack of erection. Some cause painful erection in the acute phase. So those anatomical stuff, there are therapies available for them, depending on what you do, but let's say you don't have any of those and you're a normal healthy male with normal straight penis, no curvature, there are a lot of things over the counter you can buy, like erectile vacuum pumps. Again, those anatomical issues can be corrected surgically. But beyond that, then if you're healthy, normal, then you talk about either using a vacuum pump. And then there are pills that you can use. So most of the pills, the whole idea is to stimulate blood flow down to the penis, from Viagra, Cialis, and so on and so forth, Levitra. There are also measures such as Muse, which is a suppository you put right on the tip of the penis. Some people are happy about it. And then we talk about injections, testosterone injections, or even what we call biomix or trimix, a combination of medications that you inject to the side of the penis that improves blood flow down there.
PRP.
PRP has been in the market lately.
PRP, which we
go ahead, talk about that, Mary.
PRP. Well, we do shockwave. Shockwave acoustic therapy. So
just give them one line about PRP and shockwave, Mary.
So shockwave acoustic therapy and PRP would be good options. They are non-surgical. You can have them in office and pain-free, essentially, with a good lidocaine and block. And you are basically regenerating your own tissue and your own cells, because like you said, it's blood flow that's the issue. Yeah. And so increasing blood flow into the penis for a stronger and longer erection. So, I mean, the thing I like, but you still would, when you're doing your PRP shockwave, you're still, part of your protocol will call for like a Cialis.
Yes.
To help with the blood flow. But I think it's nice to think about your own tissue regeneration, helping you to achieve,
Yeah. Just so we know, and it's been in the news, and lately the PRP is your own. It's called plasma-rich platelets. It's your own blood spun down, platelets reinfused, which helps with regeneration and blood flow angiogenesis. And then we also talk about shockwave therapy, which they're not FDA indicated, but they're data proven to help with erectile dysfunction. I think people would rather have this non-invasive therapies done compared to having a penile pump implantation, if you can, because that's a major surgical intervention that works, but it's irreversible. So for patients that you've demonstrated there's absolutely no blood flow down to the penis, severe diabetics, then maybe you consider the penile pump. But everybody else in between, you can definitely give a trial of the invasive therapy such as the PRP and the shockwave therapy.
Yeah.
With data that shows improvement in erection.
So I have a question. Are all curved penises bad penises?
How did we come up with that?
Well, because you have curve, you have
You see the
straight...
picture with bananas on the TV and
well,
posters.
not
it's
just
there.
the commercial, not just the commercial. So Peyronie's disease, right?
Yeah.
That's what that's about. But you have straight dildos, you have curved dildos,
Okay.
and curved dildos and straight dildos hit different areas. And so the whole point of a curved dildo is to hit some sensitive areas that maybe that straight doesn't get to.
Interesting.
Right?
I never thought about that.
So then that's the question, right? For women,
right,
curved penises are not necessarily bad penises. But
so women like curved penises? That's a whole new fact. That's interesting because for men, they see the curvature and they're upset. And so the answer to that from a man's standpoint is no. So curvature is just it's called Peyronie's. It's an issue that happens when there's some level of trauma that's happened to the I'll call it the skin, the encasing of the erectile tissue in the penis, and that area scars down, and so when you have an erection, it curves towards that side. As long as you're able to have penetration and there is no pain, then there is no issue with it. You can work with it. It's when when it's severely curved, beyond 45, 90 degrees, and it's hard to penetrate, or it's very painful intercourse, then that's when you should do something about it. Right. Some people are very self-aware and conscious, and even a little curvature, they want something done about it. There is therapy available. It can be done. But yeah, not all curved penises are bad.
No, I mean, because in essence, if you think about like some of the pleasure tools that are out there for penetration for women, there is a little bit of a curve to it.
So so from a women's perspective, the curve helps hit the G spot? Is that because I never actually thought about that until you said that now.
If you think about it, if you curve up and you have a G spot, if you have a G spot, you have it. Right now, everyone has one. But if it curves and you have a G spot and it's able to rub there a little bit more, you can have a little bit more sensation.
That's good curvature to the top. That's a good one, I guess. The men that have side curvatures, I don't think you're going to be able to hit that side.
There's some aberrant G spots out there.
You may have to walk. You may have to walk that angle. You may have to walk that angle.
Okay, I have another question from a, and this is on the patient's end, and this is on the men's end point of view. So, from a man's point of view, is there a realization that this is a two-part question. No. Is there a realization that clitoral stimulation and penetration are as equally important for women's pleasure? And this is I'm leading you to an answer, which is yes, it is important.
It sounds like that's a women question, but yes, okay.
So it is important, but is that something that men kind of conceptualize? It's not just the penetration, it's also the stimulation on
I mean, that comes back to the beginning of our conversation with intimacy. It's like knowing what your partner likes and what makes them orgasm, because that's where you want to get to that level of intimacy where both parties are satisfied. So if people orgasm with clitoral stimulation, then yes, and you, the partner, are attuned to that. That's what you should achieve to do. If it's with penetration, trying to find a G-spot, with curvature or with straight, either one, then that's what you do. But it sounds like you're leading me on, and it sounds like both need to be stimulated for women to be happy.
Yeah.
Yes.
Okay.
Yes.
All right. So, second question.
Okay.
Lubrication.
Absolutely.
Okay.
I say lube is life. That's what I tell all my staff and patients. Lube is life. You need lube. There's nothing shy, even if you're premenopausal, it's okay. Postmenopausal, definitely, because that's one of the things that I would guess on the female end turns them off from having sexual intimacy, because it's uncomfortable, it's dry.
But what on the man's from a man's point of view, lubrication?
I think lubrication. I mean, again, it takes two to tango. Man doesn't really need lubrication, because I guess I take that back. You do need lubrication because you don't want to feel like you're in a dry spot. It shaves but most importantly, the lubrication helps the female. I think it helps them, so they're not.
I think it does.
It does. So so it takes two to have pleasure. It takes two to be relaxed, and I think lubrication is very important. It's also finding the lubrication that works with your body. Not all lubrications are
Yes.
made the same.
Yes. That's a
Um,
good point.
Works
With your body.
yeah.
I believe as many bottles of perfume that you have at home is as many different types of lube you can have at home. You can have lube for any type of event, really. So there are different lubes on the market. We talk about a lot about that in the office, and we have some really good lubes. Beloved is one that I really like because it really does mimic a lot of the mimic very closely the female natural lubrication that you make when you're stimulated and aroused. Good Clean Love is another great lube. O-Shot makes a great lube. So there are many out there in the market. You can have 4 or 5 in your drawer beside your bed, and use one every night.
Lube is life.
It's like
Just that's it. You can put one lube for every day of the week.
yes. So that's 7.
Yeah. So
Well,
that's good.
yeah.
So let me ask you from a woman's perspective, what helps them achieve that deep level of intimacy and I guess sexual aware well, it's not so much sexual health, but sexual awareness. What helps them get in that space to achieve a good level of saying I'm having a good sex?
So again, it's getting out of your mind. I think, a lot of women as we get older, we don't clear our minds before sex, and we have a lot of hang-ups during sex that prevent us from achieving full orgasm. So that's more of a mindset. So clearing your mind, definitely. But also, like we're talking about, knowing your body and knowing your resources, knowing that it's not bad to use a pleasure tool while you're having sex with a partner. It's actually great to, even if you think you have enough lubrication, to add more on top. And you made a really good point, and I'm very happy that you talked about that foreplay. Foreplay should happen, but foreplay doesn't have to happen 5 minutes before penetration. Foreplay for you can happen throughout the day, and I think that's what we come back to. We talk about the relationship and the strength of a relationship. Talking to your partner, notes, beautiful notes written. I love notes written. I don't like notes of what to do, but notes of how much I love you, written throughout the day, like that pre-planning as you get older. I'm speaking to an older crowd because that's just where we are in life. As you get older, you have to section off time for you and a partner, and so there's nothing wrong with that. There's absolutely nothing wrong with saying it's Thursday night. We are going to take this time for ourselves and have sex and be intimate. So that buildup can happen throughout the day, with text messages and phone calls.
But spontaneity is still good too, just impromptu, and it helps, I think.
Yeah. Is that a suggestion?
But it is a suggestion, and it's putting a plug for men and for all men out there. So, and just in tune to what we're talking about. So it's not just one thing. It's living a fulfilled life, knowing what your body is, working with it, alleviating the stresses in life, communicating with your partner, and just creating time to have a great sex. Yeah. And we at Climax Aesthetic Surgery are here to help you.
Yeah. Plug in for Climax. Again, thank you so much for being here.
Yes.
I think this was a nice conversation.
Correct.
Hopefully, you all enjoyed having us both here. And if you have any questions, we're very happy to have them in the DM, either for me or for the other Dr. Ojo-Carons to answer. Hope you're able to come back another time. Thanks for subbing in.
Thanks for having me on a short notice.
Yeah.
Happy to be here.
And this is Climax After Dark. Thank you all. Have a good night.